Thank you, Dr. Vivek Barun, for joining us to the session on World Multiple Sclerosis Day. I have few questions with me that what are the risk factors for multiple sclerosis, and does family history add on to these risk factors?
Yeah, thank you. It's a very good question. So, as we know, MS is a complex autoimmune disorder. So, there are some risk factors which is known. Okay, so the some of the risk factors are environmental, like smoking, either active smoking or passive smoking, obesity acquired in the early childhood or adolescent age group, Epstein-Barr virus infection acquired again in the adolescent or early childhood, exposure to the pesticides and other chemicals also increases the risk. Low vitamin D level, if you are living far away from the equator, that also plays a role. Lack of sun exposure is also one of the risk factors. As far as genetics is concerned, so MS has got polygenic inheritance, so there is not a single gene which is believed to be caused. Many genes are there, and having a positive family history increases the risk of developing MS only 2%. So we cannot say it as a genetic disease because its inheritance is very complex. Yeah.
Thank you for explaining that, sir. So my next question is, what are the treatment methods which are available for the treatment of multiple sclerosis?
So there are two types of treatment. In the case of multiple sclerosis, one is the acute treatment. Whenever the patient has acute relapse, then we give the high dose of steroid, or we can give IVIG also. Both these treatment are given for 5 days. If they are not working, then the third option is plasma exchange, in which we do the exchange of the plasma. That is done over like alternate day, and total 5 cycles are usually given, so that is done over 10 days. So that is for the acute treatment. And to prevent the relapse, there are certain DMTs, which is called disease modifying therapies, which is available both in oral as well as IV preparation, depending on the patient's clinical profile, risk factors, and cost of the therapy also. So now we have many DMTs which is very effective, which can be even used during pregnancy also, and they are safe also in long run, and they, if taken properly, they reduce the risk of relapse and can help you in living a healthy life. Thank you.
Thank you so much for sharing your insights and experience with us, sir. It's very helpful. Thanks a lot.